Welcome to Session 5 of Benevolent AI 101 course. This week we will explore AI advancements in healthcare. In today's session, we'll discuss developments happening at the intersection of artificial intelligence and healthcare that offer great promise to humanity. As we dive into these advancements, we'll also discuss the risk and ethical considerations and potential bias that can exist within an AI algorithm to ensure that AI serves humanity in the most positive and responsible way. Because the last thing we need is for AI to perpetuate the discrimination and unfair treatment that we've received as a community in the traditional healthcare system. So on the agenda, first, we'll take a look at health issues and causes of death in the Black community. Next, we'll look at the current state of healthcare coverage in the US and how things might change with the new policies coming through in Project 2025. Then I'll dive into how AI is being used in healthcare to make diagnosis and treatments quicker and more effective. We'll also explore how AI-powered apps are helping people manage their health 24/7, right from the comfort of their own homes. Finally, we'll see how countries like India and China are using AI to support their traditional healthcare systems and why I think we should consider following their lead as we reconnect with our own African American herbalist roots. And as usual, I'll wrap with a video assignment that ties everything together. Okay, so when we look at the leading causes of death in the Black community, a few key issues stand out. Heart disease is the number one cause of death among African Americans still, making up about 22% of all deaths, according to the CDC. One major factor contributing to this is the high rates of hypertension or high blood pressure in our community. Hypertension can be caused by things like chronic stress, poor diet, obesity, genetics, and heavy drinking. Cancer comes in second, accounting for around 17% of Black deaths in the US. In fact, Black men and women generally have the highest cancer death rates compared to other racial groups, especially when it comes to cancers like prostate, breast, and cervical cancer. Factors like limited access to healthcare, lower socioeconomic status, and disparities in cancer screening and treatments all play a role in this. Pregnancy-related deaths are also a huge concern. Black women make up 43% of all pregnancy-related deaths in the US, and this number is rising year over year. Stress, poor healthcare, unconscious bias, and systematic racism are key contributors to this trend. Infant mortality is another critical issue. Black infants are more than twice as likely to die before their first birthday compared to white infants, meaning the infant mortality rate is roughly double that for Black babies. Looking ahead, we should think about how AI and other technologies can help us reduce these frightening statistics. The goal is to ensure that more of us live longer, healthier lives and can grow old without dying prematurely from these preventable causes. Having access to the right information about nutrition and healthcare is crucial for building a healthier community. Over the years, more Americans, including those in marginalized communities, have gained better access to healthcare benefits. In 2023, around 26 million Americans, about 8% of the population, didn't have health insurance. For the Black community, that number was slightly higher at 8.5%, which, while still significant, is one of the lowest uninsured rates in US history. Private insurance, often provided through an employer, remains the most common form of health coverage in the US. In 2023, 57% roughly of Americans had private insurance, compared to 56% of Black Americans. When it comes to Medicaid and Medicare, about 18.9% of all Americans and 20% of Black Americans were covered in 2023. That's roughly 1 in 5 people benefiting from this government aid. The Affordable Care Act, aka Obamacare, which became law in 2010, was designed to expand access to health coverage and make healthcare more affordable. By 2024, nearly 50 million Americans had gained coverage through the Obamacare Act, representing about 1 in 7 people in the country, or 14.3% of all Americans. Before the ACA, In 2010, 16% of African Americans were uninsured. Since ACA's implementation, the uninsured rate among Black Americans has dropped significantly from 21% to about 11% today, showing a major increase in health insurance coverage for our community alone. Now, those are some pretty refreshing statistics on healthcare currently in the US, especially in the Black community. But now let's get into Project 2025 and how it will, if implemented, negatively impact our ability to have healthcare in this country. So as stated in the previous slide, nearly a third of Black Americans receive healthcare coverage through governmental programs like Medicaid, Medicare, and the Affordable Care Act. Project 2025, however, threatens to reverse this project by chipping away at the federal funding of and increasing barriers to this government-issued insurance. Starting with Medicaid. The plan proposes cutting federal funding and allowing states to impose stricter work requirements and lifetime coverage limits on these benefits. These changes will disproportionately affect low-income families and those with chronic conditions or disabilities unable to work. Next, it suggests privatizing Medicare for seniors, which would increase their out-of-pocket costs and create unnecessary barriers to care by introducing additional approvals. The new administration has also promised to end the Affordable Care Act that, as we've discussed, helped to reduce the uninsured rate of Black Americans by 10%. Veteran benefits are also on the chopping block as Project 2025 advocates for cuts to the Department of Veteran Affairs funding, which could adversely affect healthcare services and support for veterans. This reduction may impact the quality and accessibility of care that our veterans, our brave heroes, receive currently. People are already experiencing higher prescription drug costs since the election for critical medications like insulin, which the previous Biden-Harris administration fought to cap. Now, onto the highly contested issue of women's reproductive health. Project 2025 aims to reverse advancements in reproductive rights by criminalizing the sending and receiving of abortion and birth control medications. It also proposes eliminating coverage for emergency contraception, thereby restricting women's access to comprehensive reproductive healthcare options. Finally, the agenda proposes policies that could severely restrict access to gender-affirming care for transgender individuals, including bans on hormones and puberty blockers for transgender youth. It also suggests removing federal funding from healthcare providers offering gender-affirming care to minors and redefining legal sex categories, which can further marginalize the LGBTQ+ individuals and limit their access to necessary healthcare services. At the same time that the government is rolling back public health care coverage for Americans, hundreds of thousands of American workers are being laid off across many private sectors, as well as within the federal government itself through all of these DOGE cuts. So that's slowly grinding down the 60% of Americans that have private insurance. And without public healthcare options, they will be pushed into the uninsured bucket. These layoffs will only get worse, trust me, due to the automation and the incoming economic slowdown, which means that more people will find themselves in the uninsured category, as I stated, as healthcare becomes more of a luxury here in the US. A higher number of unemployed and uninsured Americans means that medical professionals are now at risk of finding themselves also unemployed, despite years of education and professional experience. Given that households will now have to choose how to allocate their limited budgets across various basic needs, including food, shelter, transportation, utilities, and healthcare. We discussed in sessions 2 and 3 how the cost of food and shelter are increasing. Well, with these tariffs that this administration put in place, transportation and utility costs are also increasing. Many utility companies have already sent out notices to customers to expect a 10 to 20% increase in their electric and gas bills this summer. So it's realistic to assume that people will seek either inexpensive coverage or choose self-treatment options, both of which can be extremely detrimental if not done properly. So this is where I think we'll need to rely on technology, specifically artificial intelligence and robotics for help. To one, ensure that doctors can operate fast and efficiently, treating an increased number of patients at the lowest possible cost per patient. And two, to empower individuals and communities to manage their own healthcare if they cannot afford to see a doctor. First, let's take a look at some AI tools that are helping doctors with diagnosing, treating, and monitoring patients today. First up is an AI-powered medical imaging tools that can quickly analyze medical images like X-rays, MRIs, and CT scans. They can detect diseases such as cancer, fractures, neurological issues faster than a human doctor might, spotting patterns that could be missed by the human eye. This leads to quicker and earlier diagnosis, which is always good. AI can also assist doctors with offering preventive care plans to patients by cross-referencing a person's genetic info, medical history, and lifestyle habits to predict things like diabetes, heart disease, and even cancer risks before they appear. This helps doctors to take action sooner. Second, AI helps doctors create treatment plans that are customized to each patient's unique needs, like their genetic makeup and medical history. This personalized approach boosts the chances of successful treatment and reduces potential side effects. Next, AI-powered robotic systems assist doctors with complex surgeries today in many hospitals around America, offering super high precision and reducing human error. These tools make surgeries more accurate and help patients recover faster, especially with minimally invasive procedures. Additionally, AI is also helping with remote monitoring, where wearable devices, so devices they just put on, keep track of vital signs like heart rate, blood pressure, and blood sugar. If something goes wrong, these devices can alert doctors right away so they can step in sooner. AI can also help manage chronic conditions by predicting when a patient's health might worsen, giving doctors and patients a chance to act before things get serious. And in addition to helping doctors diagnose and more accurately and quickly, AI also allows them to see more patients in less time by handling routine tasks in a medical office, like patient intake, appointment scheduling, billing, and record keeping. This will reduce costs, which means doctors can offer more affordable services, especially to people without insurance. While automation may lead to fewer jobs in a medical office, it also lowers operational costs, making healthcare more accessible to more people. After all, bigger teams means higher expenses, which have to be passed on to patient fees. We need to remember that. And for those who simply cannot afford to see a real doctor despite reduced fees, self-care will need to be at the forefront of their wellness plan. Since most of us do not have medical degrees, self-diagnosing and treatment is still real risky. And the reason why many people are turning to AI-powered virtual assistants that are now available across a multitude of medical fields. Virtual assistants or AI-powered chatbots are being used to provide 24/7 support to patients in a variety of medical fields, including general health, dentistry, dermatology, and nutrition. These virtual assistants offer many services, including personalized health advice, over-the-counter treatment plans, appointment scheduling, and medication reminders. Some widely used virtual health apps with really great reviews are Sensely, which is a conversational AI chatbot named Molly, who acts as your virtual nurse for chronic healthcare patients to remind them of appointments, medication schedules, it takes their vital signs and sends that info over to doctors. This means chronic healthcare patients don't have to go into doctors' offices to have these things done, which reduces their costs. It also frees up a doctor's time. Ada Health app allows you to check your symptoms online 24/7 and find out possible causes for whatever's bothering you, from like general pain, headache, to allergy or food intolerance. So this is a wide database of information right at your fingertips. Noon, which is an AI fitness, nutrition, and health care app, offers body scanners and personalized meals plans aimed at improving your overall health. As we all know, preventive is the way to go. The way to stay out of the doctor's office is to take care of your health all the time. There are also dermatology apps like Skin Vision available in the App Store that give you the ability to take a picture of your skin, to do self-examination of your skin, and it recommends different treatment options. The app claims that its AI algorithm can even detect skin cancer with 95% accuracy. And these are just a few of the countless AI healthcare apps available today that you can look into depending on your need. There are also AI-powered mental health apps where virtual mental health counselors and therapeutic tools analyze text or voice to detect emotional distress, depression, or anxiety, providing early intervention or referrals for personal care. I see so much potential here as a free resource for Black youth and teens struggling with anxiety and depression who feel like they have no one else to talk to. While AI in healthcare holds tremendous promise, we must also recognize the risk and challenges it presents so that we can deliberately and adequately secure against them, like ensuring that patient data remains private and confidential, retraining or eliminating AI models that exhibit inherent bias stemming from the data that it was trained on, and having safeguards in place to limit access to individual and group genetic information that may be used to create biowarfare by malevolent forces. Yes, that exists. While these risks already exist within the healthcare industry and are not unique to AI adds an additional layer of concern given how quickly it shares information and processes it and how integrated it is becoming in all aspects of our life. This should not deter us, however, from exploring how AI can assist with doing the maximum amount of good and reducing unnecessary deaths and improving the overall health of our community. Because while it is tempting to deep dive all the ways it can go wrong, let's also allow ourselves to dream about how life-changing this powerful technology can be in the hands of the right physicians with the noblest of intentions. In the East, both China and India are integrating artificial intelligence with ancient health practices like traditional Chinese medicine or TCM, and Ayurvedic to suggest herbal combinations and lifestyle changes based on historical texts and clinical data. So researchers at the Beijing University of Chinese Medicine developed AI models to analyze tongue images to detect imbalances in color and coding to classify conditions like diabetes and gastritis. Projects like the China Academy of Chinese Medical Sciences have developed deep learning models to identify potential drug candidates from a large TCM herbal database to recommend complex herbal concoctions instead of synthetic drugs. In India, startups like Narok Street offer AI chatbots that provide lifestyle advice based on Ayurvedic principles. And companies such as Himalaya Wellness use AI to optimize formulations for products like ashwagandha. These are beautiful examples of how the natural world, which is full of natural remedies, can be enhanced by technology. Let's not forget that we also have a rich history of natural medicine practices in the Black American community. We grew up with our grandmothers boiling roots and making ointments. Think of the power of combining this deep ancestral time-tested wisdom with a powerful technology. This would make herbalism accessible again to all of us, right on our phones. Over time, we could regain healing knowledge that we lost and become less dependent on synthetic drugs and big pharma. This is something I truly hope we manifest as a collective. Okay, so for homework, I recommend viewing a brief video about remote healthcare tech trends reshaping how care is administered. This will show how the virtual AI assistants, scanners, and wearable devices we discussed are being used today. And as always, I appreciate you dedicating time to learn with me. I look forward to seeing you guys back next week for more fun, benevolent AI content. Thank you. Bye.